Good afternoon or good morning, everyone, depending on where you're joining us from. Welcome to our webinar today. Thank you so much for joining us. We hope you are doing well today. My name is Anna Corona, and I am pleased to kick our webinar off today, titled Bright Futures Presents Resources, Strategies, and Experiences to Advance National Performance Measures 11 and 12. As a reminder, we're going to be recording this webinar, and we will also be sharing these slides out to all of our registrants once the webinar has concluded. So you'll see links throughout our presentation. You will have access to those links once we wrap up today. So next slide, please. So a quick overview for our agenda today. We are going to center around NPMs 11 and 12. And for each of those NPMs, we're going to start off hearing from our resource centers related to those NPMs. And they're going to give us an overview and key resources from their organizations that may be helpful to you all in your work. And those overviews will be followed by state stories for NPM 11 from New Mexico and from NPM 12, Virginia. And after each of the sections there, we're going to have an opportunity for Q&A. Just a couple of housekeeping notes here. Again, I mentioned the webinar will be recorded and posted. All participants are going to be muted, so please make sure you keep yourselves muted unless you'd like to come off of mute to ask a question live. And you all will have opportunities to ask questions throughout the webinar. And if we go to the next slide, I will share how you can do that using the Zoom functions. So you have two options in your toolbar at the bottom of your screen. The first one you'll see there is a chat box. Please use this one to interact with each other. You can practice now typing into the chat to say hello, let us know your name and where you're joining us from. And then we also have a Q&A box there that you can use to ask questions of any of the panelists that you'll hear from today. So please use the Q&A box to ask panelists questions. Feel free to pop your questions in there as panelists are talking. And we will have a running tab of questions on our end that we will make sure that we do our best to get to all of them during the question and answer period. And if you have any technical difficulties, please email me if you want to take a moment to just jot down my email that's on the screen there, and I will assist you in having those issues resolved. And I see everybody chatting into our chat box. Welcome. We have folks from all over. Very, very happy to have you all here today. All right, hopefully everyone's had a chance to write down my email, so we can go ahead and move on to the next slide, and I will turn it over to my colleague, Kathy at Bright Futures.
Terrific. Thank you so much, Anna. Hi, everyone. I'm Kathy Janis, and I'm manager of Bright Futures Implementation. And so I wanted to welcome everyone, as Anna did, and really thank you for your time, and thank our panelists for being here today. So I just wanted to let you know that all of the panelists, all the speakers today, we have a disclosure statement. None of us have anything to disclose. So next slide. So that's all of our speakers today. Next slide. Okay, so we want to take just a couple minutes to get everyone sort of on the same page as we're going through this. So I wanted to take just a couple minutes to talk a little bit about Bright Futures, and then I'll hand this over to my other colleagues. So what is Bright Futures? So the mission of Bright Futures is to promote and improve the health, education, and well-being of infants, children, adolescents, families, and communities. And just to kind of center us, Bright Futures is the health promotion and disease prevention part of the medical home. So that's how it kind of all works together within the medical home, medical neighborhood. And again, at the heart of the medical home is that relationship between the clinician and the family or youth. Next slide, please. So I wanted to take a moment on behalf of myself and Jamie Jones to acknowledge the AAP and MCHB as our funders. So I wanted to just take a moment and let you know we've acknowledged their support. Next slide. Okay, so really quick, in addition to clinicians, some people think of Bright Futures as being just for healthcare professionals, but it really is a wide range of people who we really do make sure that Bright Futures is utilized, is good for. So Bright Futures, their main audiences are states and communities. So folks in public health, folks in state Title V, all the states and communities. Families are a huge audience for us, as well as healthcare professionals. So again, at the heart of Bright Futures is the medical home component. And thinking about how other people have been using Bright Futures, Everyone plays a really important role in keeping children healthy and safe. And for example, many state Medicaid agencies have adopted Bright Futures as their standard of care. And in most EPSDT programs, they follow the aperidice schedule. So next slide, please. So talking about the aperidice schedule, this is one resource that many people know about. So that's the resource on the left side. It's a large sort of dot plot that kind of tells you what to do in a well-child visit. But the way it links with the Bright Futures guidelines is the Bright Futures guidelines tell you how to do and how to do it and how to do it well. So we are in the 4th edition of the Bright Futures guidelines. So if you have an old edition, this is what the newest edition looks like. So you might want to check your bookshelf and make sure you have the latest version of the Bright Futures guidelines, 4th edition, as well as we've also developed the tool and resource kit, and that is all aligned with the Bright Futures 4th edition. So I want to make sure that you are aware of what the newest products are. Now, the aperidice schedule is a resource that recommends exactly what you should do and screen for at every visit. And what we do is similar to the immunization schedule. The aperidice schedule is updated annually by the AAP as new evidence emergence. So every March we come out with a new aperidice schedule. So again, that's another resource. You want to make sure that you get a new version every year. And if you're interested, you can always reach out to the Bright Futures National Resource Center for more information about that. Next slide, please. So of special interest, we just wanted to kind of go over some of the resources that you might be most interested in. So Bright Futures is a really large document, really large resource. So we do like to put together these tip sheets that kind of help break it down a little bit into different topics. So on our clinical practice page on our website, you'll find a whole series of implementation tip sheets. It includes practical tips. Some of them are going over specific health promotion themes that are in the book. So, for example, promoting healthy weight, promoting mental health, things like that. So it's a good resource to do. And if you haven't been to the Bright Futures website, it's a good resource to kind of look through and get some practical tips to implement Bright Futures. Next slide, please. And also on the website, I also wanted to bring your attention to the states and communities pages on the Bright Futures website. So on the states and communities page, you will find a list of states, and for almost every state, we have an state implementation story. And so we're over time, we're collecting more stories and we're updating stories. So take a minute when you have a chance to go to your state, read through the story we have for you. If you're interested in updating your state, you can always reach out to us. Or we kind of are looking for more stories. So we're always interested in hearing from you, but take a look and see and read through what other states are doing to implement Bright Futures. And then another really great set of resources are with our AMCHIP partners. AMCHIP has developed a couple issue briefs for us recently. And one of the issue briefs is actually a crosswalk that shows how Bright Futures guidelines correlate with the national performance measures. Another issue brief features 3 state stories about how states are implementing Bright Futures. And then there's also a curated list of Bright Futures resources that are significant to state Title V MCH programs in efforts to advance your state's action plans. And all of those resources are found on the states and communities section of our website. Next slide, please. Okay, so now I'm going to turn it over to my colleague, Jamie Jones, who's going to talk about the National Resource Center. Jamie?
Thanks, Kathy. Hi, everyone. As Kathy just said, my name is Jamie Jones, and I am the manager of medical home initiatives at the American Academy of Pediatrics. I am excited to be here today to highlight medical home tools and resources to support the work of state Title V MCH and children and youth with special healthcare needs programs in increasing the number of SHIN who receive care through a medical home and in a well-functioning system. As part of my role, I manage the National Resource Center for Patient Family-Centered Medical Home, which moving forward, I will refer to as the NRC. The NRC is a cooperative agreement between the American Academy of Pediatrics and the Maternal and Child Health Bureau, as Kathy mentioned on the previous slides. The goal of the NRC is to improve the health and well-being of and strengthen systems of services for children and youth with special healthcare needs and their families by providing technical assistance and supporting implementation of the patient family-centered medical home. The NRC provides technical assistance and support to our main stakeholders, which are Title V and SHIN programs, pediatricians, and families. We develop tools and resources to support implementation of medical home at the clinical, community, and state level, and I will highlight some of our top resources in the upcoming slides. Next slide, please. So this slide just highlights the key resources I will discuss as part of the presentation. However, I would just like to note that the NRC offers countless other tools and resources for medical home implementation. Next slide, please. So developed in partnership with Boston Children's Hospital and a long list of multidisciplinary care coordination experts, the Pediatric Care Coordination Curriculum, second edition, is an excellent resource to developing a multidisciplinary approach to care coordination implementation at the state level for children and youth with special health care needs and their families. The curriculum offers 6 modules, those being integrated care, family and professional partnerships, social determinants of health, measurement, technology, and evaluation. Each module has a customizable slide deck and facilitator guide, and there's no order per se to the curriculum. Each module is freestanding, so you don't need to start with module 1 if you want to focus on social determinants of health. You don't need to have previously implemented integrated care or family professional partnerships. An example of implementation of Module 1, Integrated Care, is available on the NRC website. This promising practice highlights a pilot implemented in Arizona, a partnership between Arizona Title V and SHIN, Family Leadership, and Phoenix Children's Hospital, as well as the state AAP chapter. A write-up and recording are available, underscoring practical strategies for those interested in implementing a training in their own state. Next slide, please. So year 2 of the National Resource Center was very heavily focused on social determinants of health. We successfully executed a virtual action learning collaborative with 4 states to implement social determinants of health screening, referral, and follow-up for children and youth with special health care needs and their families. All of the resources that were developed for the Action Learning Collaborative are available on the NRC website. This includes the Project Change package that has countless tools and resources supporting social determinants of health implementation at the clinical, community, and state level. In addition to recordings of the monthly educational webinars, topics include family engagement, working with diverse families, and documentation, referral, and follow-up. In addition to the Action Learning Collaborative resources, we also have a fact sheet series. These fact sheets, developed in partnership with the National Academy for State Health Policy, discuss social determinants of health screening and referrals for SHIN and their families. Opportunities for collaboration between Title V, Medicaid, and pediatricians are discussed, and state-level examples provide innovative and replicable strategies for screenings and referrals. Next slide, please. Since 2014, the NRC has implemented an annual education series. Since being refunded for this newest iteration in 2018, the first 2 series that have been developed were specifically focused on the intersection of Title V, families, and pediatricians. Gaining Ground, the primary care pediatrician's role in public health systems of care for SHIN, is a 3-part podcast series discussing real-life examples, strategies, and opportunities to develop partnership between Title V, primary care pediatricians, and families. Featured faculty provide an overview of the history and current functions of state Title V, MCH, and SHIN programs, as well as benefits of multidisciplinary partnerships. In continuing with last year's Social Determinants of Health theme, the education series, Making Connections, the critical role of family-centered care in addressing social determinants of health for SHIN, highlighted the role of Title V, pediatricians, families, and others in addressing social determinants of health for SHIN using components of the medical home model. All of the recordings and available resources are on our website, as you can see, and available for viewing. Next slide, please. The customizable essential data for pediatricians on National Performance Measure 11 or medical home template is a tool to share state-level data on medical home for SHIN and their families from the National Survey for Children's Health with pediatricians. This template provides opportunities for state-level agencies such as Title V and SHIN and AAP chapters to share the number of SHIN receiving care through a medical home in their state compared to the national average, why the National Survey for Children's Health matters to pediatricians, how the data impacts state-level programs, initiatives, and policies for SHIN and their families, and then who to contact in the state's Title V or SHIN program for more resources to support children and youth with special health care needs and their families through family-centered care. For any state that's interested in using this template, please feel free to contact myself or through the general National Resource Center email address, and we will be happy to work with you to complete it. Next slide, please. And lastly, I just want to share a technical assistance opportunity for states who are focused on NPM 11 medical home, NPM 12 transitions, and or NPM 15 financing. Catalyst Center, Got Transition, and the National Resource Center has joined together to form the Advancing Systems of Services for Children and Youth with Special Health Care Needs Network. The network offers a no wrong door approach to technical assistance to address coordinated and ongoing comprehensive care, transition to adult health care, and adequate private and or public insurance for children and youth with special health care needs and their families. Since March 2020, the network has hosted virtual cafes for SHIN directors to discuss various topics related to the COVID-19 response. Many of the notes from these sessions are available to review and provide implementation strategies for each specific topic area, such as behavioral health or emergency preparedness. We additionally offer an ongoing list of response resources. Next slide, please. So thank you all so much for this opportunity for me to talk about the National Resource Center and our medical home tools and resources. Please feel free to contact us for anything we can do to support your medical home implementation needs. And now I will turn it over to the New Mexico team, Susan Chacon and Dr. Melissa Mason.
Hi, thank you.
Hi, everyone.
So I am a pediatrician in private practice in Albuquerque, New Mexico. I'm also a past president of the New Mexico Pediatric Society, which is the New Mexico chapter of the American Academy of Pediatrics. And I'll let Susan introduce herself and then we'll get started.
Hi, everyone. Susan Chacon, New Mexico Department of Health. I'm the Title V Children and Youth with Special Health Care Needs Director. And we're going to talk about our collaboration and our 6 degrees. So we'll be using the image as a reference point for our discussion.
Yeah, so when you see pictures of bacon, think of Kevin Bacon. So I'm sure most of you have heard about the 6 degrees of separation from Kevin Bacon. So we'll explain our 6 degrees and then also help you all figure out how to get your 6 degrees. And I'll explain more about that in just a minute. So in talking about how we came to work together, because I was involved in the New Mexico Pediatric Society, there was a woman named Nancy Lewis who she had gotten a grant through AMCHIP to work with the Early Childhood Comprehensive Systems team in our state, specifically on a project called Act Early, which was to pick up signs of autism and promote regular screening. And I was invited to attend these meetings because the Pediatric Society had supported Nancy, had written a letter of support, as well as invited her to present at our annual CME conference. So Nancy reached out to me to see if I would be willing to attend these meetings as a representative for the pediatricians in our state. During that time, back in the day when we had meetings where we could all be in the same room, we realized that sitting around the room were key stakeholders in a lot of different organizations, people who worked in different sectors of health. And I felt like in that room, if each one of us wrote down everybody we interacted with or resources we knew, that we probably had a huge data bank of information for providers and for families. So that's where the idea of 6 degrees of separation came up, was we feel like with just not even 6 degrees, we could actually figure out huge resources in a database for our state. So with that group, we started to talk about, is there a singular database that anybody in our state could use to look up resources? Resources for provider, for example, if I wanted to refer a family to get speech therapy for their child in a small city somewhere else in the state, how do I find that? If a family needed to figure out, what therapists are in their area, how to find a doctor, how to access resources, how do we do that? How do we create that? So after Nancy's grant was finishing up, there was an extension, but she was no longer able to write for that and asked if the Pediatric Society would be willing to try and get that grant to continue work. So we said, sure. We decided with that grant to try to create this database that we were thinking would be so fantastic. And in researching for that, actually discovered that it basically already existed. The New Mexico Medical Home Portal is that database, and it is specific. It was created actually out of Utah to provide resources for families who have kids with special healthcare needs, but also providers who care for them. And I know Susan's going to go through that, but it was this really aha moment that we do really have a lot of great resources in our state, but some of that information is siloed and we don't all necessarily know about it. So the focus of our grant, once we discovered that there is this great database, was to really work on getting the word out about the database, making sure that providers and families are aware of it, how to use it. So that was very exciting to find that. So with that, I'm going to turn it over to Susan to talk more about that and then how we ended up working together. Well, actually,
Right.
Yes, go ahead.
That was the beginning. So next slide, please. So these are just highlighting some of the projects that we ended up starting working on together. The first, as Melissa mentioned, was the Early Childhood Comprehensive Systems Committee that I would go to the meeting sometimes and be part of it. And I think, Melissa, you started getting invited because you were looking for that one-stop shop place for information and resources. And so then I was able to bring the work that we had been doing since I think like 2017 on the Medical Home Portal to this group and to Melissa as part of the New Mexico Pediatric Society. And we decided as a group that we were going to collaborate and support this project because it was already an ongoing project that we were using for Title V to help us meet our NPM 11 medical home as part of our activities. And then we're going to talk a little bit about the Action Learning Collaborative that Jamie had referenced, because we were part of that collaborative around the social determinants of health. So I'm just going to give you a couple screenshots of the Medical Home Portal, if I could have the next slide. So this is the landing page. It is a web-based system, so anyone can access it, but there's several states. New Mexico is one state where we are part of the whole project. We pay a licensing fee, so we have our own page specific to our states and our own resource page. So this is a landing page, and it was developed by the University of Utah, and it's really to assist and support families and professionals working together to provide accurate and reliable information about medical conditions, assist with care coordination, and there's also a resource directory. So if I could have the next slide. So this is just an example of the condition-specific page referencing spina bifida. So there's just a lot of information in there. And as you can see, everything's accessible for families, for providers, for other medical staff as well. And if I could have the next page, there's a section on transition. So there's a lot of information, I think, taken from the National Resource Center on transition that we're going to hear a little bit more about, but there's a lot of information there. And then if I could have the next page, this is the service directory where we collaborate with our information resource network through the University of New Mexico, and it populates resources in every county. So it's an ongoing project. And this project, we have a state team. We meet bi-monthly, and Melissa is part of our team. And it also includes the university, the information network, and our family-to-family health information center, Kathy Salazar, who's also became more of a partner and a collaborator over the past couple of years as we've been working together. So we meet bi-monthly, as I said, with Utah, and we make suggestions for different pages. We just created a Nows page. We've also been working on COVID information. And so this is just an example of how we are working together. Anything you want to say about that, Melissa?
I guess one is just to reiterate that this medical home portal there are certain states that have state-specific information, but there is national information. So as Kathy pointed out, for example, the information on transitions, that's applicable to anybody, anywhere. So, and it's free for anybody to use. So it's definitely worth looking at, because while there is specific information, there's actually a ton of information that could be utilized for anybody.
Right. Okay, next slide, please. So we'll talk briefly about, so we had been working together on the medical home project, and then we were asked by the National Resource Center to participate in the Social Determinants of Health Action Learning Collaborative with several other states. And we needed to put together a team. So we needed a physician to be part of our team. So I talked to our Title V director, Janice Gonzalez, who also is in leadership on the New Mexico Pediatric Society. She's a pediatrician. And maybe this is just small town New Mexico, but she recommended Melissa. And Melissa was supposed to just be our physician advisor, but it turned out that she actually agreed to be the pediatrician that implemented the project. So our other partners we had been working with the QI group on some different projects. So they were helping us with this project. Kathy Salazar from Parents Reaching Out, which is our F2F, became a strong partner for this project. And our LEND program, we had a trainee who helped us with the project, and this became her capstone project. So it was another collaboration. And I will let Melissa talk about her experience as being part of this project.
So I will keep it brief, but basically what we did was, in my practice, which is a private practice, we were able to implement social determinant of health screening within the clinic. It was easier than I thought it would be. However, during this time, not only did COVID happen, but we also implemented a new electronic medical record in our office. So it's not successful at this moment, but it is something that we'll be able to re-implement once we actually kind of get stabilized and back on our feet. It was really a nice opportunity. I knew a lot of these people in the community, but to work again with Kathy Salazar from Parents Reaching Out was key, because she said, if you have families who need referrals, you can just call me, email me. I know that isn't something that would work everywhere. And it's, for this project, it was great. So we're continuing to work to try to improve referrals. Kathy is also on the AAP Family Partnerships Executive Committee. So she's been really key in helping us work well with families.
Yeah, and I just have to say from Title V perspective, it's really nice to work with Melissa and get feedback from a pediatrician who's working in the community and kind of hear what goes on in her office. So that type of feedback is really helpful because I kind of hear it sometimes big picture and a lot around specialty care, but just kind of the day-to-day, and especially right now during COVID, kind of what they've been up against. It's really helpful feedback. So, okay, next slide, please. So now we're just going to spend a little time talking about kind of our recommendations and how you might be able to replicate this in your own states and communities. And next slide, please.
So this is the example of what happened with us with our 6 degrees of separation from our Kevin Bacon, which was our partnership with Title V, our New Mexico chapter of the AAP, and parents reaching out. So in the lighter blue are individuals, the darker blue, those are organizations. So started with Nancy Lewis, who had an AMCHIP grant. She presented at a conference and then contacted me to become a member of their early childhood comprehensive systems team. From that team, we decided, gosh, we need some kind of a database. So then came up with, hey, the medical home portal is that database and is great. Pulled in Susan Chacon to work with us on the portal. And then Susan was working on this Action Learning Collaborative, pulled me in. And then we also pulled in our Parents Reaching Out representative. So next slide, please. So these are your 6 degrees. So your organization can go to the AAP's website, and I'll show you in just a minute how to find that information. But on the bottom of their main page is a section about AAP, and this is public. You do not have to be a member of the AAP. Anybody can access this information. Under About AAP, there's a place for chapter websites where you can find your particular state chapter, get their contact information, and then reach out and start working on those partnerships. So next slide, please. So on the far left at the bottom, it depends if you're looking at a phone or desktop, but on the bottom, on the far right under About AAP, you'll see it's a little hard to read, but the chapters and district section, if you click on that, it then takes you to the chapter websites. And then as you can see, I selected Colorado, but it takes you to their landing page, and on the top is their way to contact the chapter. So please don't hesitate to reach out to your chapters. They are always looking for opportunities to work with you all, especially around things that improve care for not only the practitioners, but the families and kids they care for. So I just would recommend, don't hesitate to do that. Reach out. Really great things can happen from those partnerships. Susan, anything you wanted to add?
Yes, I agree. Don't be intimidated. Reach out, and I think you'll find strong partnerships because we're all reaching for the same goals, and that's to improve care for children across our state. So I would just encourage you to try to make contact with your local chapter. And I believe that's the end of our presentation. Is there time for questions or anything that's come up in the chat box?
Hi, Susan and Melissa, this is Kathy. Thank you so much. That was really, really great. We did have one question come up, and I know, Susan, I think you'd mentioned this to us before, but the question is, are there opportunities for other states to pay a licensing fee and add state-specific information to the medical home portal?
Yes, absolutely. They're always looking for more partners. So I can chat in my email, and anybody can reach out to me, and I can get you in touch with the portal folks. So they would love to have more states participate.
Terrific. And we have everyone's contact information at the end of our presentation.
Okay, perfect.
Yeah. So I think that was the only question that came through our question and answer box. We'll give just a minute for people to kind of think through all the information you gave. If there's anything else that people want to ask. And as we're thinking, Susan, or Melissa, if you want to, what are the next, I know you've made this great relationship. So what are the kind of things you guys are thinking about where this relationship could go? Are there things that are immediately that you're thinking about doing, or, short and long-term plans for the relationship you guys have built?
I know that, Kathy and I have been talking recently about really the mental health crisis that has only been made worse because of COVID and social isolation, particularly with teens. And so we're looking at working with a medical home portal to try to continue to increase resources there. And then she also mentioned the neonatal opioid withdrawal syndrome, trying to also bulk that up to give resources to providers who care for these families and kids in the community, not just in the hospital directly for that care, but once they go home and how to support them. So as far as, I feel like it's this small group of people who continue to end up around the same table working on issues. So I don't have any other specific projects, but I'm always open. Susan, how about you?
Yeah, I agree. Because now we meet frequently, different projects are continuously coming up. And like Melissa stated, the most recent one is behavioral health services. So I think we now have a platform and our relationships so that we can continue to work on different projects as things come up.
That's terrific. Well, thank you so much. We really, really appreciate it. And I don't see any other questions. Susan, I think you're going to get some emails. People are interested in the license information.
That's awesome.
For next
the
time.
more the better. Yep.
Okay, terrific.
Thank you.
And Melissa, thank you so much for reminding people about the national information they could get. So even if it's not something they can license at this point, they can still take advantage of the medical home portal. So,
absolutely. Yeah, thank you.
Terrific. All right. So what we're going to do, if I can have the next slide, and we're going to transition to transition. So what we're going to do is we'd like everyone to stay on. If medical home was the only topic you're interested in, feel free if you need to leave, but we would love everyone to stay on, and we're going to talk about National Performance Measure 12. And the next slide, I'm going to transfer, the next speaker will be Patience White. So Patience, take it over.
Great. Thank you so much. I'm Dr. Patience White, and I co-direct Got Transition with Peggy McManus. And Got Transition is also a federally funded by Bureau of Maternal and Child Health as the National Center on Healthcare Transition. So today I'm really excited to share what we've done in updating our new website. And this first slide is really telling you how we went about it. For about 8 months or so, we solicited feedback. There are lots of people who had come to our website over the prior 4 years, and we wanted to get their feedback about it and about the process. How did the 6 core elements work? And actually, we got an awful lot of positive feedback to no recommendations. So we asked families and providers and Title V, it was up as really a link that anybody could give us feedback. It was sort of fun. We got some international feedback as well. And then we did a lot of updates, many of whom were suggested by the people that replied to us. So really this whole update is really responding to people who are using our information on our website. So you can see that the updates, we have sort of new questions, and around our readiness assessment, we dropped the reading levels to the majority of the tools. We have new ways to assess the process that you're going to undertake. And I thought it was wonderful that we got a lot of feedback from youth as well as parents saying, would you please split our pages? We'd like to have our own page as youth and our own page as parents. And then we've added, with a lot of people really wanted to have a clinician transition feedback tool available. So the next slide shows you the actual landing page. So when you get to our new website, you're going to see quickly that there's sort of 4 areas that I'm going to walk through. One is for the 6 core elements. The other is for youth and young adults. Then there's one for parents and caregivers. And then there's a component for resources and research here. There's always news and announcement there. We have a very popular quiz that I'll mention later that's also on this page. The next slide really goes into what's available for the 6 core elements. You have an overview, and then you have you'll see a picture, ability to actually click on either of the 3 packages that are available. One, obviously, it's all from the point of view of the youth, those that are transitioning to adult healthcare clinician, those that are already with a med-peds clinician or a family medicine clinician. Clinician is a very broad term here. We're not just talking about physicians. We're talking about all the other support folks that are in the medical delivery system, and those that are not changing clinicians, and those that are actually going to leave their pediatric practice and are going to be joining an internal medicine practice. I'm going to show you, we now have implementation guides. This is completely new. It's the #1 question we would get is, how do you go about doing this 6 core element process? We have a section on payment. Every year we update the codes for transition. So it's a very popular place for the people to go to learn a little bit more about coding and reimbursement. And then we get a lot of questions about the 6 core elements. So there are frequently asked questions there. You know, where did they come from? Are the tools validated? There's a whole series of questions and answers there. Next slide. So here you're seeing when you want to go to this area in the 6 core elements, you can see the 3 packages, the 3 different colors. And you have the opportunity, as you can look down below the big squares here, is that you can actually get the 6 core element package. It's all in Spanish. And then if you want to get a full implementation guide, so you can get this on any of these. They're all tailored to the different packages. And you can there also go and get details about each core element. So the next slide. So this just shows you exactly if you had clicked on the leaving a practice to go to an adult practice. You can see here that you can obviously download the whole package. Then you can look at you can click on each of these different particular core elements, and you can get general information and the tools that are available under each one of these. Next slide, please. So the #1 question we get from everybody, whether you're care coordination program, practices, systems, school-based health centers, is how do you start this? How do you go about beginning a healthcare transition process? And you can see here on the right, there's really how to implement the 6 core elements of healthcare transition. I'll show you that. And then a lot of this has to do with quality improvement. And many people are not as familiar as others about the process. So working with a very well-known quality improvement group at Atrium Health, we actually developed a quality improvement primer here. And it has all examples related to transition. So it's very focused and tailored to this particular process. Next slide. Shows you sort of what's there on how to implement. It's really a practical step-by-step supplement here. There's sort of 9 steps, as you can see here, what you would think about going through as you're beginning to put this process together. And actually, we did this in conjunction with the 10 big systems and some of the local practices that we've been working with to have them really tell us what it is they really wanted to know, so that we'd be sure we would have it here available in this how-to process. The next slide just shows you that if you decide you'd like to know a little bit more about the quality improvement process, you can see it's a companion piece here, and it's really intended to help practices or anybody understand the quality improvement and how to apply it to their work. And each of these different components here has a little bit of history about it, a relationship to research, and sort of the benefit to healthcare teams and patients. And you can see there, particularly #6 is tools for improvement. I think that's probably the one that people look at the most and has a lot of examples directly related to healthcare transition. Next slide, please. So this is now just showing you exactly what you do if you want to look at any of the 6 core elements individually. So you can see there's sort of, we'll take an example of the one on the left here. You can see there's the transition policy guide. You actually can have the guide, and then there's a lot of examples. We now have many, many practices and systems who have actually implemented this and have given us examples so you can get a sense of what they are. The next slide gives you a sense under each of these core elements, you have an implementation guide. So it tells you what the purpose of this particular core element is, what the objectives might be, and then some of the considerations as you're thinking about creating, for example, a policy. What do you need to think about? And then how would you implement a policy in a particular practice? So it really gives you those tools and how to measure it. And then it gives you a lot of sample transition and care policies, for example, and guides, and lots of additional resources. So in each of the core elements and each of the 3 packages, you have this implementation guide associated with each of the core elements that gives you a way to really think through the process as you're beginning to add any of them to your practice or situation. Next slide, please. So this shows you the next large area on our website for youth and young adults. And the next slide gives you a sense of some of the FAQ areas. So one on the upper left is how does the 2 different systems differ between pediatric and adult care? We have the readiness example of our readiness assessment. The next is 5 steps to prepare for healthcare transition. This is sort of an easy toolkit that providers or anybody could use. It's been very helpful, particularly since we're doing most things on telehealth now. It has a few sections that young people can work through and then come back and talk with their provider about questions and areas that they're unsure. Then you can there's a click through to the family toolkit. Very popular is setting up the medical ID feature on your Apple Health or your Android. It's a very common resource that young people really find very helpful. And then a lot of them want to know, what does turning 18 mean for those that are not looking for supported decision-making or legal documents here? This is, what does it mean when I've turned 18? What does it mean to my health around confidentiality? The next slide really gives you a shot of the parent and caregiver area, and then we'll go to the next slide. We have a new family toolkit, and we have a very active and wonderfully helpful National Family Advisory Group, and you can see who are part of this. And they came up with this idea and really put this family toolkit together. The next slide sort of gives you a sense of what's included in it. And it's done by questions. When should my child and I start to think about transition? What are the recommended services? What questions can my child and I ask our doctor? How does my role and my child's role change? How can I learn if my child needs help with decision making? What are some of the legal changes in healthcare that happen at age 18? What are the differences between pediatric and adult care? How ready is my child to transition to adult care and manage their own health and healthcare? So that gives you a sense. Each of them have a lot of tools to answer these questions. It is going to be translated into Spanish and probably be available in the next couple of months. This is quite new. We've just really put it out there. We actually have a webinar up on our website if people want to listen to that. Next slide, please. So finally, there's a resources and research page. We have a lot of information here, a lot of policy and research papers, there's educational resources. There's a state Title V tab, as you can see here. It has a lot of information about care coordination surveys that we've done and a variety of webinars that we've offered. State Title V, they're all there. We have a section on special populations, those particularly those with developmental disability and intellectual disability. Then obviously, if somebody comes here on the youth and families, we'll send them back to the other pages. And then a section on non-health transitions such as employment and school. Next slide, please. So I have a couple of questions, one of the most common questions we get, so I can show you the resource quickly. The first is, how can healthcare transition be integrated into preventive care along with Bright Futures? We put a group together, including those from Bright Futures, to really add some extra questions and advice around each of the age groups that are already there in Bright Futures, but we added the 22 to 25 age group. So you'll be able to, when you get these slide decks, really just click right on the clinician toolkit for this kind of area that you want, if you want to incorporate it into your primary care practice. Next slide, please. Another one is, we get a lot, is how can Title V identify willing adult primary and specialty providers? We have a webinar series that is part of the Title V Care Coordination Initiatives. And we have a link there to go right there, and you'll see there's a way you can survey. And we have some examples from other Title V that have gone out to try and find the appropriate adult providers. Next slide, please. So another question we get is, how can Title V identify the percentage of youth and with or without special healthcare needs who have received transition services? Every year, the National Survey of Children's Health now is coming out, and the most recent one is the 2018-2019, and we put together the actual figures and numbers as well as the ones that are state-based, so you can actually see what the numbers are for your state. You click on this. Next slide, please. Another question is, how can Title V assist clinicians to develop a healthcare process in their practice? That's where this how to implement the 6 core elements guide came from. And so easily you can work with them. And of course, we're there to help anybody as they have questions and are thinking about how to go about this process. So that's what we're here for. We're here to answer your questions or anybody's questions as you're going forward this. And I think we have one more question here. Next slide. So a lot of people ask, can I find some free CME? And yes, there's a 1-hour free CME actually that goes through the 2018 AAP, AFP, ACP clinical report here. And you can easily do it and they can get 1 hour free CME, as well as social work and nursing education credits as well. So I think that's it. You can go to the next slide, where I'm just thanking everybody for the opportunity that we had to show us our new website that we're so excited about. And now I'm going to turn it over to our wonderful colleague from Virginia, Marcus Allen. Take it away.
Thank you, Dr. Patience-White. Appreciate it. Good afternoon, everyone, or good morning, I guess, depending on where you are. I'm excited to be able to talk to you today about some of the transition work that we do in Virginia. So one of the things that I wanted to start off saying about our Children and Youth with Special Healthcare Needs program here in Virginia is that we have very strong health system partnerships across our state. I can't take credit for creating those partnerships, but I think I can take credit for continuing to sustain them and nourish them. And what I would encourage people to do, especially when it comes to transition, is to work on your partnerships. Partnerships are key because we can work together and combine our resources to make a difference. So one of the things that we've done, I don't know if I mentioned this, but I'm the Children and Youth with Special Healthcare Needs Director here in Virginia. And with all of our programs, our Care Connection for Children program that provides care coordination services for children with special needs, mostly of a physical nature. Virginia Bleeding Disorders program, which is mostly for children who have hemophilia, our Pediatric Comprehensive Sickle Cell program, and our Child Development Clinic Services program. We've written transition as a priority into their work plans. And I think one of the things that in addition to the partnerships that we have, one of the things that also makes this strong is that our work plans, we have contracts with our partners. So our work plans become a part of those contracts. So there's a higher level of accountability and focus when it comes to those actual requirements. Next slide, please. So the next thing I wanted to do was to share some examples of some of the accomplishments of our programs when it comes to promoting transition in our state. So our Care Connection, Care Coordination program developed a transition readiness questionnaire. They did this some years ago, and we revised it roughly 5 years ago. The most recent version is based on the readiness tool from GAT Transition. And what I think, one of the powers of the GAT Transition tool is I think it makes it easy. It's easy to use that tool and sort of critique it, or not so much critique it, but to modify it to fit your needs. And that's what we did. Our care coordinators made specific changes to fit our program when it comes to promoting transition. So staff at the Children's Hospital of the King's Daughters developed our unique tool from the GAT Transition tool, and we implemented that tool, or we are still implementing that tool at all of our centers across the state. Another thing I want to emphasize, I talked about this earlier, about making sure that you work hard on your partnerships, because the partnership at CHKD and the leadership at CHKD is what really got this done. So you don't have to always be the one in your Title V program or in your independent physician's office to do all of the work yourself. Our partner had a strong interest in this, and she worked to update our tool and to create a tool that we all could agree on. So please empower and encourage your partners to help you lead when it comes to transition and any other issues that we deal with. So the next example I wanted to provide is a fun activity that our Sickle Cell Center at Virginia Commonwealth University does twice a year. Of course, they're not able to do it right now because of COVID, but they have 2 yearly camping events for youth with sickle cell disease. The first night is sort of like a fun night where they have a dinner for the kids, and they are focused on games and education. And one of the things that I love that they do is they sit down, the clinicians, so the physician assistant who helps to manage the clinic with a pediatric hematologist along with a social worker, they sit down with the kids and they have a discussion with them about sickle cell disease. They help them to understand what the disease is, how the disease affects their bodies. And what this does is it gives them a sense of how to explain the disease as a growing child to providers, and helps to prepare them for the next step in their life. So they do phonics, they do an example where they show the genetic inheritance pattern, and I think the kids really get a kick out of it. Then the other example I wanted to provide was our hemophilia program, or bleeding disorders program. We partner very closely with Virginia Commonwealth University to run this program, because they have a very long-standing hemophilia or bleeding disorders program. And we have several centers throughout our state. And for years, VCU has been the lead when it comes to working with each and every single one of our clients to prepare them for transition. Generally, they will transition them to the VCU center in Richmond, but they also work with them to find a provider locally. One of the things that we're really excited about this year, they, along with us, we have been successful at working with the University of Virginia to transition youth to their adult center. So what happens is the youth in that area, Charlottesville, they get pediatric care at UVA, and then they can seamlessly transition to adult care within the university, a place that they're familiar with, and a place that that they already know how to access. And I would say that I think when you're able to find options like this, it really just, I think, makes the transition so much easier for families, because they can continue going to a place that they feel confident about and feel confident, feel good about as far as the type of care that they're receiving. And the last example I will tell you is really something that our governor's office had a big focus on last year for the General Assembly, and that was creating an adult comprehensive sickle cell network. Our governor here in Virginia has become really interested in equity and really tackling inequities that exist in our healthcare system. I'm not going to go into what the inequities are for sickle cell, but I think many people entitled and MCH work understand what they are. So what he did was he worked with us to create or propose a bill to create this adult comprehensive sickle cell network, and not only to create it, but to fund it. So we mirrored this network off of our pediatric network with the goal of doing what I mentioned earlier about the UVA bleeding disorders example, and that's to encourage or require anyone who gets the funding to work closely with the pediatric center in their community, so that when it's time for youth to transition, they will be familiar with the adult center, and the transition itself will be more seamless. That's one of the problems that we found when it comes with sickle cell, is we don't have a lot of adult centers in our state, only one at VCU, Virginia Commonwealth University, and we have found that it's difficult for people to travel across the state to that center. So we want to have matching centers in each region where we can make this more seamless. And some of the things that we are discussing, for one, I don't think I said this, but the bill passed and was signed by the governor. We have the funding, and we are in the process now of securing our contractual relationships. But like I was about to say, our primary goal is to require the adult providers to not only have a relationship with the pediatric providers, but more importantly, to have a relationship with the youth and families before they actually transition to adult care. So some of the things that we're going to be writing into their contracts is that they need to have a presence in the pediatric centers and build a relationship with some of the teams before they actually transition. So that means taking the time to be visible there, taking the time to attend some clinics. That's not necessarily practicing there, but it's meeting with the families and developing that relationship, because we have found that when they're confident in the relationship, people are more likely to move to the next phase of their life, especially when it comes to clinical care. Next slide, please. So one of the criticisms that I've gotten since I've been here, which I think is a very valid criticism, is that we focus too much on the programs. So you need to do more. You need to do more broader population health work, which is fair. So one of the things we did, we were pushed by our former office director. I guess it's been probably 4 or 5 years ago, to apply for technical assistance from the Maternal and Child Health Workforce Development Center that's managed by University of North Carolina at Chapel Hill. So we applied, we were successful, and I have to say it was a good experience. I think the number one reason I would say that it helped us was because it forced us to act. They worked with us to bring together our stakeholders. We created sort of a plan on what we were going to achieve and a timeline for getting it done. So as many people know in this world, we all have so many competing priorities. And what that does is it makes it hard to focus on one thing. So what they did was they helped to provide that structure and that focus that we really needed. And accountability, because we knew every month, we knew we had a meeting coming up with them and we wanted to be prepared. So I'd say it took maybe, we worked with them for quite a while. It was 6 months to a year. And what we ended up deciding to do was to have a stakeholder meeting of stakeholders, interested stakeholders throughout our state. And what came out of that was to create some modules for transition and medical home. Next slide, please. So that's what you see here. If you look to the left, you'll see a screenshot of our modules. This was, it was a 2-year process, much more difficult than I ever dreamed it would be. So it took us 2 years to get it up and going. And quite frankly, we're still in the process on working to promote it. We were very fortunate, I would have to say, to be able to partner with the University of Virginia on this project. They host existing breastfeeding and newborn screening modules for us. So our vision was to create a suite of educational modules related to maternal and child health with UVA. So specifically talking about transition, you can see the link here to the modules. Again, we just recently refreshed them, and it's on a new platform, which I'm extremely excited about. Another thing I want to say is GAT Transition has been a huge resource for our Virginia-specific work. We contacted them very early on, and we asked for support and permission to utilize their resources. The only reason we did something separate is because we wanted to have specific information about Virginia on our website when it comes to the modules. But we couldn't find a better resource for expertise than GAT Transition. So it's just been great to work with them. And they even came back when they made some changes to their website to let us know so we could update our links, which is something we have done and relaunched our site. So one of the most important things we wanted to do that we heard from our family-to-family partner was to not just focus on providers. So we do have a provider-focused model. Module. It is complementary, and that's thanks to Title V funding. So what that means is anyone across the country can take the modules for free, and CMEs are offered, and that's a good carrot for nurses and physicians. And it's being made possible because the UVA Office of Continuing Education and Medical Education has the ability to offer those credits. But like I was mentioning before, our family-to-family lead wanted us to make sure that we did something for families. So we have a separate module for any interested families and lay people who want to learn about transition and why transition is important, how to make it happen for your child, it actually should be in cooperation with your child. So we're very proud of this resource, and I encourage anyone who's interested to please visit our site. Next slide. So that concludes my part of the presentation. And let me know if there are any questions.
Thanks, Marcus. I am going to jump in here quickly just to share a little bit about some AMCHIP specific resources related to NPMs 11 and 12. And I realized when I opened the presentation, I was so excited to get started that I didn't actually say where I'm from. So my name is Anna, and I am a program manager for child and adolescent health at the Association of Maternal and Child Health Programs. So just quickly here, want to share these resources that we have available for you all. So the resource on the left is our National Standards for Systems of Care for Children and Youth with Special Healthcare Needs. And those were created in partnership with NASHP and the Lucille Packard Foundation. And this is an interactive website for the national standards for systems of care for children and youth with special healthcare needs. And the website is there. Encourage you to pop in there and take a look around. It is a really engaging and interactive website. So check that out. And then on the right here next to that resource is the National Care Coordination Standards for Children and Youth with Special Healthcare Needs. This new resource was actually created by NASHP, and it was developed to be used alongside the national standards and are designed to help state officials and other stakeholders develop and strengthen high quality care coordination for children. So the hyperlink is there on the slide. And if you could go to the next slide. We have an e-learning module here specific to data integration to improve systems of care. And this is really an interactive learning experience that allows you to take a deeper dive into quality measurement for improving systems of care for children and youth with special health care needs. It takes less than 30 minutes to finish, and it does feature interactive learning and perspectives from Title V, similar to perspectives that you got today, but case studies in there via interviews. So be sure to check that out if you want more case studies about data integration. And then finally, on the next slide, AMCHIP has published a series of implementation toolkits. We have one for nearly every NPM, National Performance Measure. So I've just highlighted those for 11 and 12 on the screen here. And these were created in partnership with the National Resource Center for Patient Family Centered Medical Home, which you heard from today, and also with GOT Transition. So if you move to the next slide, I've laid out here how you can use these toolkits. So on the left is the toolkit landing page, and you'll see it highlights at the top which specific national performance measure it's for, and then beneath that it shows which state and territorial Title V programs selected this national performance measure to focus on. And then at the bottom half of that landing page there, you see all the different strategic approaches that Title V uses to advance the specific national performance measure. And then again, at the bottom, you'll see an icon for the partners that we worked with to develop these toolkits. So then once you click into a strategic approach within that landing page of the implementation toolkit, you'll get a page that looks like the screenshot on the right. And so at the top, it'll just identify which strategic approach you clicked on. And then within that, you'll see all of the resources related to that strategic approach. And we were really intentional in creating these toolkits to include resources that were really practical, that could be really taken, that you could take and run with if you're a Title V program looking to replicate or modify any of these strategies for your setting. So I encourage you to take a look at the toolkits for NPMs 11 and 12 and also poke around there. Like I said, we have one for nearly every NPM on our website. So check those out if you're interested. And that concludes the AMCHIP resources that I wanted to share today with you all. So I think we're going to move into a Q&A for Patience and Marcus's presentation. So please feel free, if you'd like to put your questions in the Q&A box, feel free to pop those in there. I see we have a couple already, so I'll hand it over to Kathy to moderate those.
All right, thank you so much, Anna, and thank you, Patience and Marcus. This has been, I know I learned a lot. So we do have a couple technical questions and then a couple other questions, and we'll kind of give people a chance to ask more. So Patience, I think this question would be best for you. Technically, how much time would it realistically take to train providers on the 6 core elements using the implementation guides and the QI processes to practice implementation?
So this is a great question. And I think what's important here is that a practice doesn't have to do everything. I mean, obviously you have everything available. It's like any technical assistance site. You have everything there in front of you. But I think it would depend a lot on what size the practice is, what of the core elements they'd like to do, and a little bit about their resources. So if you're working with a small practice, they can actually put many of these core elements in over the next week to 10 days because they have total control over their environment. And think about it, it isn't quick just because you're changing practice patterns. And so you have to get people that are really in good partnership together. If you're actually going to work with another practice, you really want to have a pediatric and an adult practice working together. So small practices can do it in a matter of weeks to months. But actually, when a large system comes into this, there's a lot of planning that goes into it because they're going to change their electronic medical records. They're going to do a lot of things as they go through this. So those can take up to 6 months of planning and then as much as a year or two beyond. There are some actual articles on our website that really shows how 7 of the systems actually worked on it together over 18 months. And many of them got a large number of the core elements in their system up and working. So the answer is it depends, as always in anything that's complicated. It can be short if you're going to do just 1 or 2. Sometimes just doing a policy is something that helps families to really see what the process is going to be. And then if you're going to be a huge integrated system, it's going to take you a lot longer because you're changing multiple practices. So for example, Mercy Children's in Kansas, they've been at this for about 3 years now. They have all of their 55 divisions actually doing transition. It's all a centralized process. And then I worked with a small practice in Florida, and they completely did it over about 4 or 5 weeks. And then COVID hit. I haven't talked to them recently, so it just depends on the size, what the population is. If you're dealing a very complex population, that's going to be different for resources than if you're working with just preventive care, as you do with Bright Futures. That's very different. So I hope I've answered the question, because it really does depend on what the situation is.
That's great, Patience. And I think that's referring back, it sounds like that, your story of 6 or 7 programs working together, I think that would be a great resource for someone to look at. This is another question that came through, and I know, Marcus, you were able to respond online. But think about other things to do. How can you help State Title V persuade providers system-wide to adopt the GOT Transition's 6 core elements? Have you guys tackled that with, per se, any kind of helpful tips to persuade the providers in their states to adopt GOT Transition or the core elements? Either Marcus or Patience, or even Melissa, if you're still on, there are things that we could help the providers better understand the importance of doing this and how to better persuade them to do this.
Well, I will say that it's part of Bright Futures recommends that we help prepare youth for transition. Another thing is that it's just the right thing to do when it comes to providing good care for the families that they serve. And I think I want to check with Patience to make sure I'm right on this, but I think there may be now some reimbursement that they can possibly get for providing for working with youth on transition. Am I correct about that, Patience?
Yeah, I mean, we have a coding and reimbursement tip sheet, as I mentioned earlier, that helps you think through exactly, are you actually getting reimbursed for some of these codes? Now, of course, you have to work with your insurance companies, right? This isn't just say, hey, I want to be paid for this. You're going to have to work through that with them. A lot of times, families are the people that really begin to drive this process. They begin to ask about it. And I think that since the American Academy of Pediatrics, the American Academy of Family Physician, and the American College of Physicians really sat down in 2011 and then again in 2018 and really said, this is the evidence. This is an evidence-based practice. This is something that you should be thinking about and doing. Now, of course, there are many things to do, but I think quality care, this is part of giving quality care. I think now is a tough time in anything because it's stressful around COVID. There are lots of things that's hard to convince practices to do anything other than survive at the moment. Melissa certainly this. They may not want to leave the practice right in the middle of COVID, but they'll certainly get ready for it. But we've had people that are willing to do that, right? And joint telehealth visits between the pediatric and adult practices have definitely made this a much easier process. So I think there's a lot of things to talk to practices about. They have many things on their plate, so that you want to really listen. What is it they want to do? But families are your ally here, as are you. And going out and making suggestions and saying it doesn't have to be so daunting. They do have to agree to do it, though. I mean, it's like anything, right? They have to agree to use Bright Futures for that matter. So Melissa, do you have any comment?
Yes, thank you. So I will say I learned a lot from this webinar, including all the information about transitions. And it wasn't because I wasn't interested or care. I just didn't know the resources existed, as seems to happen a lot. So what I would recommend is to please reach out to your state chapters, because what I plan on doing from this information is including that in our monthly electronic newsletter with our membership, to make sure that people are aware of the resources that are out there. I think this is something that we do in day-to-day practice, but having something that makes it really easy for providers and families is outstanding. So work with your state chapters, help get that information out there. I think the telehealth visits to do it is a phenomenal idea. Whether or not we get paid for it, it's something we need to do. It's always nice to get paid to take that time to do it, but it really comes down to providing good care. So thank you for all these great resources. Please contact your chapters, work with them. They can help get the word out to the providers in the state.
Yeah, we work every year to develop this coding reimbursement, and are always looking for ways to think about value-based payment. So there is a report on our website if you really want to get creative and work with a payer to think through how you could actually do this. But we're always working with the AEP and the ACP and the AFP to put in new ways to try and get billing for transition. So stay tuned. I think it'll get better and better as we go forward.
That's great. And any of the other presenters? Susan, did you have any other thoughts about how to work, how to kind of persuade the providers, or other places that maybe we forgot to mention? Other things to do?
I think it's a really valid question, because I know we've struggled with it too, as at the state level. And how we've been trying to address it is we do have our care coordinators that work with the community pediatricians and practices. And so we have our own transition work that we do with our clients. And then we try to include the PCP in the work that we're trying to do with the client during that transition period. So it's really kind of family by family that we're trying to do this. But we've tried. It's a challenge to make it more of a statewide initiative. You almost have to do it practice by practice. Oh.
I think, Peggy, you've joined. Do you have any thoughts?
Thanks. Hi. Apologies for my being late. I think oftentimes pediatric providers equate transition with transfer. And we often get that pushback that, I've got a 14-year-old. I don't want to talk about transfer. And so the clarity that transition is not equal to transfer is, I think, an important message, and to kind of encourage this notion of this planning process. And the more anticipation people have for it, the better off they feel. And again, the inclusion of this as part of routine preventive care, primary care, specialty care, behavioral health care is something we all strive for, and it's quite not there yet. So, to imagine that it's just a tack on for somebody who's 20 years old is really not what we're talking about here. So I think conveying that transition is more than transfer is an important case to be made. Thank you.
That's a great point, Peggy. We do have one more question. Are you able to share the level of receptiveness or resistance of practices regarding quality improvement of healthcare transition for children and youth with special healthcare needs? Does anyone want to take that?
I'm not quite sure I understand the level of resistance or.
Yeah, I get looking for maybe some examples or what your experience has been, the level of resistance of practices regarding quality improvement of healthcare transition.
Well, Marcus, do you want to start? I'll be happy to add because you've worked with practices and we do a lot across the country. So go ahead.
Yeah, I would say I've had a lot of experience with this when it comes to pediatric hematologists for sickle cell disease. And I haven't found that they're resistant, to be honest. I have found pediatricians to be incredibly caring and incredible advocates for the children. Is they get really frustrated when it comes to finding somewhere to help their children transition to. So they will start doing the work. I'm not going to tell you it's perfect, but Dr. White explained that it doesn't have to be perfect. You got to start somewhere, and you build as time goes. So they do that, and I think that what really frustrates them is not having somewhere to transition their youth to. That is a very difficult thing. But I don't think that they are resistant for the most part. If we found resistance, it's really because of time. It's not about whether or not they feel it is valuable, because they all feel that it's one of the most important things that they do is trying to take care of their families and then to prepare them for adult care so that they become, especially children and youth, become independent.
Yeah, I didn't know whether Melissa or anybody else wanted to comment.
I thank you, Marcus, for calling out pediatricians as being fierce advocates. That is what we do. And I don't know anybody who's resistant to learning how to do something better. I know that often the issue is, it's not that we don't want to screen for things. We don't want to help get kids ready to move on to somebody else. We just don't know where to send them. We don't know who is accepting patients. We don't know where to refer people sometimes. So it's really a either lack of resources or a lack of knowledge of what's available, which in my mind is probably the biggest hurdle in helping get them on to the next step.
You know, and you have chapters, the American College of Physicians and chapters, the American Academy of Family Physicians in each state. There could be joint programs so that people get to know each other. You know, a lot of this is about building partnerships, and state Title V organizations are excellent at that. And physicians are too. They often just need a little nudge to get together. I remember we did that in the District of Columbia. We literally had to tell people, please don't sit next to another pediatrician. You know, sort of like being at a school dance. You know, find somebody to get to know, because then you'll find out that, oh my gosh, you know, they're just in a neighborhood away, and they're willing to actually do it. And they also, the adult providers, being both a pediatrician and adult provider, they need the information. They need the young person prepared. I think everybody really wants to do this. It just takes a little bit of extra partnership and working together and meeting each other. So Title V can be a great broker here. I mean, along with the state chapters. Any other, I mean, clearly in certain diseases, partnering with the patient organization is also really helpful. That's been true. We're part of a very large sickle cell disease grant from PCORI in the southeast of the country. And boy, it's been a wonderful triad they put together. You know, the patient, the pediatric and adult provider, and the local sickle cell disease patient organization. And they offloaded a lot of the issues that sometimes practices find hard. How do we get people to be sure they show up in the appointment? Who's going to do the patient education? So there's a lot of creative ways that people can think about doing this. I'm sure there are other folks have ideas, but as I say, I don't think people, I've never found them resistant. I think once they see a pathway, they really get it going. And I think they see the kind of partnerships they can gain together, it works better. But everybody is incredibly busy. So whether you're asking a special ed teacher to put health into their program, right? Everybody's stretched. So what you want to do is say, here's some possible ways you can do this. Here are some resources, and I think you'll find people are very interested. And of course, we're at the other end of the phone. We're always happy to help and give TA as practices begin to think about this.
That's
You know,
terrific.
This is Peg. I had another thought, again, from our local experience in the District of Columbia. What we did was look at, again, we were working with a Children's National Medical Center, but to look at a population of transition-aged young adults and do a geomap of where they live and see, well, what are the adult practices near where they live? And in the case that we were looking at, we found a few federally qualified health centers. And then again, with the MCO, form some sort of effort to outreach to those adult providers to build this kind of connectedness between the pediatric and the adult systems. I think that there could be more of a science to this identification if it was done in partnership with the MCO. Just a thought.
That's great, Peggy. So being cognizant of time, we could be talking all day, but I do want to be aware that we're so we're going to advance to the next slide. And I think what everyone, I always think of trying to think of what you can do immediately, sort of shorthand, long term. I think everyone's sort of action item is to make sure they know who their AAP chapter rep is and AAFP chapter. Like, reach out to your pediatric and your adult provider in your state and just make sure you have those contacts. And if you don't know who they are, give them a call. They'd love to know what people are doing. As Melissa said, I know the AAP chapters always like to know what state Title V is doing so you can work in concert with each other. So we do have the list of presenters here, and as Anna had mentioned, we're going to post these slides as well as the recording, so you don't have to take a screenshot of this or anything. You'll have this accessed. So I wanted to thank you very much. Move to the next slide. Wanted to thank everyone's time. Really wanted to thank the presenters. I really, really appreciate your time and energy on this, and thank you all for attending the webinar. And have a good rest of the day. Thank you.
Yeah, have a wonderful holiday.
Thank you.